the presentation I gave today was on the impact or the efficacy of non-drug treatment as a complementary treatment for patients with dementia. So in the study we carried out, we did the randomized controlled trials to try to demonstrate the efficacy of non-drug treatment as compared to nothing. And the second objective of our study was to demonstrate the superiority of music-based intervention as compared to non-musical activities. So for this purpose, we recruited 150 patients in a residential care home who had a moderate to severe Alzheimer disease, and we randomly assigned them to 3 groups. One followed music-based intervention, another one followed cooking activities, as a non-musical activity, and the other one was treatment as usual, no specific activity. And every patient was involved in a group setting of 8 people, and the clinical trial lasts 10 weeks for each participant. So during this study, we used a very strict methodology, and we assessed the patients 2 times before the beginning of the intervention to assess the test-retest effect. Then we test them during the intervention, mid and at the end of the intervention, and then we looked at the remanence effect 2 weeks and 4 weeks after the end to see how the behavior changes, if it remains better or if eventually it go back to baseline. So this is what we did, and we used to assess those patient blinded assessor. So they were completely blind about the group affiliation of the patients, and they didn't know when they assessed them if they were at the beginning of the trial or the end of the trial. So it was well controlled, and the intervention was based on a 5 weeks intervention, twice a week, so 15 hours altogether, an hour and a half each time, and we tested the impact of those activities. Our main objective was to test the impact of those activities on emotional states by measuring mood. If the mood becomes more positive or if it remains slightly negative. And then we were also interested in looking at the impact of those activities on behavioral functioning, because we know that those patients become very agitated and very aggressive sometimes, and we wanted to see how those activities could eventually decrease this bad behavior. And we also assessed cognitive functions to see how eventually it will improve or not cognitive activities. And the final outcomes that we measure was the caregiver's distress, because one goal of our study is to see how we can also improve caregiver distress by those activities.